Hi everyone, my name is Jared O'Connor and this is my Reviewing Health News assignment presentation. So for my news article, I went over to ScienceDaily.com and just went on the Health tab, scrolled through a couple different headlines and waited for one that sounded interesting to me. So I ended up on this one. It was titled, "When It Comes to Obesity-Related Cancers, Where You Shop for Food Matters." So very in line with chronic disease, and epidemiology, so I figured why not read it. So this was published just last week on April 2nd by the University of Connecticut, and a short little summary. Obesity is at epidemic proportions in the United States, where more than 40% of adults are obese and more than 70% are overweight. A team of researchers developed a novel tool to help understand consumer behavior at the county level and to study the relationship between where people shop for their food and the risk of obesity-related cancers. So this news article is a secondary source. I was, like I said, able to find it on Science Daily. So beginning in the upper left-hand corner of this slide here, this is what you see at the beginning when you click on the link. I was able to scroll all the way to the bottom, which found the original journal reference. In the upper right-hand corner, you see the DOI is embedded there, which I was just easily able to click on, and it brought me right to the original research article from BMC Medicine. I was also interested if this was on PubMed, so I just copy and pasted the article into the search bar of PubMed, and it was there. So the original article, study objectives were: obesity-related cancers have significant implications on healthcare costs and life expectancy. While a lot of research has analyzed the availability of healthy food options, this study aims to research actual consumer behaviors in food purchasing. So how did they do this? They pulled data from 2,900 U.S. counties containing food retailer information, and CDC cancer mortality was gathered to analyze the following indices: activity-based, which was the percentage of visits to healthy food retailers relative to total food retailer visits per county, and a location-based index, which was the percentage of healthy food retailers out of all retailers in a county. So what did they find? They found that activity-based index showed a negative association with obesity-related cancer mortality rates, where a standard deviation increase in this index correlated with an 18% reduction in the odds of being in a high-risk area. So what does this really mean? So they found that counties where people visited healthy food retailers more often had significantly lower obesity-related cancer death rates. Just having more healthy food stores nearby wasn't strongly associated with a better health outcome. The better health outcomes were seen where health-related behaviors, what people do, can be a greater predictor of health than the built environment, what is available. So comparing this with a news article, I'd say the news article was maybe a 4 to 5 minute read. It was fairly quick. I did find that the key takeaways did remain in alignment. The article accurately states the main findings, that food purchasing behaviors are more strongly associated with obesity-related cancer mortality than the availability of healthy food options. That was certainly not lost in translation. What I found was lost in translation was there was an oversimplified understanding of the research methods. So a lot of these details in the research article were missed in the news article, so readers may not fully understand how this data was collected, how the research was brought about. Potential misinterpretations, a big one I found was causation versus correlation. The study identified correlations between shopping behaviors and cancer mortality, but not a causal relationship. I think the average layperson reading the news article may think this is causation, not correlation. And then another misinterpretation is population versus individual level findings. I just think that using county level data may not fully accurately describe individual level behaviors that readers may not be able to understand. And then some cautious takeaways. I think the reader should still recognize that access to healthy food options remain a critical factor in obesity-related cancers. I think they shouldn't just completely ignore that. And it's important to keep in mind the abundance of social determinants that impact health status. So original article critiques, I think a big strength is that it was the first study of its kind to analyze activity-based drivers. It also discusses policy implications. Intervention should target both infrastructure and behavioral change. That was a big hitting point. The limitations that it is an observational study, so cross-sectional studies cannot infer causal relationships, just associations, like I said. And it does not consider associations at the individual level, just the broad population level. And lastly, the key message, which I think was hit in both the research and the news article, is that consumer behavior is more strongly associated with lower obesity-related cancer mortality than just the availability of healthy food options. Thank you.